Jen?
All right, Reynolds, thank you. Now, if you're like me, you've got dozens of pairs of flip-flops. It's summertime, they're easy, they're comfortable, but are flip-flops killing our feet? That was the title of an article that I read last week, so we're going to get down to the bottom of it. Joining us live in studio is Dr. Ron Williamson. He's a podiatrist right here in Atlanta.
That's right.
Dr. Ron, you've appeared on the doctors before. Let's talk about flip-flops and how they could literally be hurting our feet from head to toe, or heel to foot, or heel to toe.
Now, flip-flops are a summer staple. Everyone loves to wear flip-flops, but there are certain things you need to look for when you're purchasing a flip-flop.
Okay.
The worst thing about a flip-flop is that it does not support your foot very, very well. No good arch support and no good heel support. So when you're looking for a flip-flop, you need to look for something that's going to cup your heel a little bit and give your arch some good support. Now, if you don't have those things, there are certain conditions that you can acquire from wearing flip-flops, like Achilles tendonitis, heel pain, even little stress fractures and things of that nature. Another thing with flip-flops is your foot is exposed. I mean, it's exposed to the elements, so cuts, abrasions, and all those things can happen if your foot is not well protected.
Do you see a lot of that from patients in the summertime?
We really do, especially heel pain and plantar fasciitis. We see a lot of that as well.
So I brought in about half of my collection of flip-flops. And you mentioned the arches. With people with low arches, can they wear flip-flops?
Well, you know what? They can, but it comes with the price. It's the price you pay. Because you don't have an arch there, you're not getting the appropriate shock absorption that you would need. And a flip-flop does not provide good shock absorption at all. So you're putting yourself at increased risk for pathology.
Is there any good flip-flop?
You know what? The flip-flops we have here, some of them have thinner or thicker soles. So
this is the thick one.
That's a good one. This one
right.
here, the sole is thicker, so it's going to provide a little bit more cushion and support.
So this is more of like an athletic. I think it was a Nike flip-flop, so meant to.
Yeah, that's a better one. And when you're out shopping for flip-flops, you can just pick up the device and bend it like this. If it bends freely too much, then it's not a good flip-flop. So things made of leather are a better product, actually.
Okay, so what other types of problems? You mentioned sort of abrasions on the foot. Any other types of issues like that?
Yeah, because your toes have to work extra hard to keep your foot on the flip-flop. So you get things like metatarsalgia, which is inflammation and pain under the knuckle bones of the foot. So things like that can happen. Shin splints. Some people can have pain as far up as the knee and the hip from flip-flops. But that's what we typically gravitate to during the summer months.
Oh, for sure. So, well, it's hot outside, right?
Exactly.
So flip-flops are a better way to stay cool.
Exactly.
Well, we're going to invite our viewers to ask their questions about flip-flops. I put the article up on Facebook and a link as well to the study, and we're going to talk a little more about this coming up in the next hour. For me, this is a summer staple, and really, year-round, I will wear a flip-flop.
Right. But just make good choices when choosing them. Make good, healthy choices.
Fashion choices, or
well,
no?
We pay the price for being fashionable sometimes.
We do. That we do. Yeah. All right. Dr. Ron Williamson, thank you so much. You'll be back again next hour, right?
I will.
All right. So viewers can ask your questions, stick them on Facebook or Twitter, and we'll talk about it in about an hour. In the meantime, we'll send it back over to Reynolds.
That's right. And coming up, we're going to